An anecdotal note template could be useful to even observe brief student behaviors. That last video lasted only 1 minute. However, with an anecdotal note template, a clinical instructor may be able to cue into a few behaviors that may show concern about their critical thinking and the safety of this patient. Again, our patient data shows that this was Mr. Smith, 70-year-old male with CHF. Same patient. However, in the second case, the student does not note that the pulse oximeter is down to 88%. They did not complete any further assessments, thus not recognizing any cues and not doing any head-to-toe assessments. They failed to prioritize the data and did not properly analyze the cues. They did not replace the nasal cannula that was there. Safety was an issue as they left the side rail down. Responding in communication, difficult to see in the video perhaps, but they did not knock. They did not do any hand hygiene. They do not have gloves on. They did not check any patient identifiers. They did not check the armband. And their clear and confident communication was not present. They kind of appear nervous and uncertain with their communication. Evaluating outcomes, there were no reassessments done, and they seemed confused about the plan of care. In fact, the student even states they're unclear about what is going on. Clearly, this does not really portray professionalism. So the anecdotal note template can be used for both positive student performances and more negative student performances.